Hey everybody, welcome back to Bread and Butter Primary Care. I'm Dr. Stokes. Today we're going to be talking about blood pressure some more. The title of this video is Essential Hypertension versus Secondary and When to Take a Deeper Look. So we're going to talk a little bit more about when do you have that trigger to do a little bit more lab evaluation and a little bit more checking to see if there's something else going on when you're dealing with someone who's having resistant hypertension. In the previous video, some of the previous videos, we talked about initial medication management for high blood pressure, and now we're going to talk about how do you know when maybe something else is going on. So you can split blood pressure hypertension into two categories: essential hypertension and secondary hypertension. Essential hypertension is blood pressure that is high just because, I guess you could say. So there's no particular reason for it. Combination of lifestyle, genetics, and those types of things. By far and away the most common type of hypertension you're going to be dealing with. Secondary hypertension is high blood pressure that has some other cause. So there's something else making the blood pressure high. And so the question is, when do you assume it's just essential hypertension, and what makes you think you need to look for other things? And so two general rules to think about when you're determining essential versus secondary hypertension. The first one is when you reach for the fourth medicine. So there's three classes of medication that are usually the first line for treatment of hypertension. We talked about this in the previous video. ACE and ARBs, thiazide diuretics, and calcium channel blockers. If you have a patient on all three of those medicines at good, reasonable to high doses, and they're still not well controlled, and you're reaching for that fourth medicine, probably a beta blocker or something, at the same time you reach for the fourth medicine, you also reach out for more lab studies to see if something else is going on, maybe a little bit more history, find out if something's going on. Most essential hypertension can be managed with lifestyle changes and those three medications. If you're reaching for a fourth, it might still be essential hypertension. There are plenty of people who need four drugs to manage it in resistant cases, but you should at least look and make sure you're not missing something. So that's one. Second time to definitely check is if there are strange, out of the ordinary physical exam findings or history elements. So people who have had great blood pressure and all of a sudden it's high. People who have moments of blood pressure where they get sweaty and headaches and have these attacks and their blood pressure is high, and other times it's normal. So strange physical exam findings, things that don't fit the usual essential hypertension. Most blood pressure is asymptomatic. People don't feel anything, they don't have any symptoms, not all the time, but most of the time. So when there are obvious and sometimes dramatic symptoms, that would be a reason to check as well. Okay, so you're reaching for the fourth medicine, there's strange exam findings or strange things on the history are two reasons to look for secondary hypertension. There's a whole host of things that can cause secondary hypertension. I'm going to focus on probably I don't know if the most common, definitely some of the most common, and then maybe one of the more famous reasons for secondary hypertension. So most common, medications. You always have to think, am I causing, I meaning the doctor, the healthcare in general, causing the problem? Sometimes medications for other conditions can actually be the cause for someone's high blood pressure. I had a patient in the past who was on chemotherapy for a tumor that they were having treated, and that chemotherapy put their blood pressure through the roof. We had that person on for, I think, even 5 hypertensives to try and keep the blood pressure controlled. Once she finished her treatment, the blood pressure was fine with no medications. So medications is one reason why people might have a secondary hypertension. The two other ones you hear most about, renal artery stenosis and pheochromocytomas, both relatively rare, especially the pheochromocytoma. That's one of the big things that, one of those things in medical school that are famous for being taught and tested and drilled into you, and then you never ever actually see it. So pheochromocytoma, a tumor that secretes epinephrine and hormones that raise the blood pressure. Usually those people have moments of high blood pressure. So those are the people who have headache and sweating and symptoms associated with high blood pressure, and otherwise they're fine. Renal artery stenosis is another one where the artery that feeds the kidneys, the renal artery, is stenosed. It's too thin, and the regulatory mechanism that that artery has in the control of blood pressure is thrown off. Okay, so if you're reaching for that fourth medicine, they have strange symptoms, things don't seem to fit, then it's time to do a little bit more looking. Now, most people who have essential hypertension, you're going to already have had some labs. I think I'll probably do another video on routine lab work in blood pressure while we're doing the blood pressure lectures. So stay tuned for that. But you're probably going to have checked a renal function. You're going to have some liver functions. Things to add on if you're starting to look for that secondary hypertension. Check out a thyroid. Make sure they're not hyperthyroid. That could be contributing to some high blood pressure. For the renal artery stenosis, you can check renin-aldosterone ratios and levels. If those are elevated and off, then that could be a sign of renal artery stenosis. A real common thing you might see on boards is a uncharacteristic jump in the creatinine when you start an ACE inhibitor. So if you have a person who comes in, they're a new hypertensive, you put them on lisinopril, and then a few weeks to a month later you recheck their creatinine, their renal panel, and it's jumped more than 30%. That person, there's a chance that they've got renal artery stenosis, and that's what's caused that jump. You might see that on boards. You might see it in real life too, so that's something to watch out for. So, renin, aldosterone levels, and then in order to check for a pheochromocytoma, you would do urine metanephrines, 24-hour urine collection to test the metanephrines. That's not something I've done very often. I think maybe one time I actually ordered that. Some people may go that far into the evaluation. By that time, you may be seeking the help of a nephrologist or a specialist to see what's going on, but that's what you could do. So just something to think about when you start treating blood pressure. You're reaching for that fourth medicine. They've got strange signs or symptoms. Check their medications. Check for some secondary causes, just to make sure you're not missing anything. Hope that's helpful. Any questions, comments, please leave comments below, and we'll see you in another video. Have a great one.